Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it all to you. Consciousness-based medicine is medicine that works through your consciousness. The opposite of that, you could say, is physical or chemical medicine that works through your body directly. We have penicillin, for instance, a drug that stops bacteria from growing, and this is a very good example of chemical medicine. We have surgery, where we're cutting a body up and removing an object or whatever. This is a physical intervention. But consciousness medicine is when we are working on the consciousness. And what is to be worked on is understanding and attitudes. If we have negative attitudes, we can make ourselves miserable, and we can easily produce a depression or even a psychosis. Our negative beliefs about ourselves and the world becomes our experience, and a lot of suffering simply comes from believing things which are not true. So if you are getting rid of these negative beliefs, you will dramatically improve your health status. But it's more tricky, because very often we are not conscious about our own consciousness. So if we're going to a doctor, we're getting a drug for depression, we believe it, we get a chemical cure. But actually recent research in active placebo has shown that most likely the drug has no specific effect on the depression at all. It is only because you feel a toxic effect that you believe that you are getting a real medicine, and this belief helps you to change your attitudes. We call this active placebo, and most of the drugs used by doctors, and almost all the drugs used in psychiatry, seems to be based on the mechanism of active placebo. That means that you're getting a drug, you feel a toxic effect, you believe this is active and effective medicine, and because of that you believe that now you're in good hands and things will improve and go your way, so you change your attitude and become more positive. But of course there's a price to pay for this indirect impact on consciousness through an extremely poisoned drug that will give you a lot of side effects and health problems, as pedagogy recently has shown even might kill you. So this is a risk to take to go this way, and this is, you can say, for unconscious people. People who are more conscious about their own consciousness will know that they need to work on the consciousness, so they will not accept the indirect way with a drug, but they will work directly with their attitudes and their understanding of themselves, and engage into a project of self-exploration. And the holistic doctor, the classical doctor, is exactly doing that. Together with the patient, he or she is helping the patient to look inside and explore all the feelings, all the emotions, all the attitudes, all the events, everything that is there in the personal history and in the personality and in the emotional realm and the patient's subconscious. And as you explore yourself and come to know yourself better, you will gradually be better and heal. Spontaneous healing of cancer, HIV, heart diseases seems to be strongly associated with a revelation, a sudden understanding of these connections and the inner life. So we believe that consciousness-based medicine is the future medicine, and that as the Western population and the people of the world grow more conscious, they will prefer to work directly with their own consciousness instead of using drugs and indirect means.